Hello. In this video, I would like to explain to you about the uses and development of the drug spironolactone. Spironolactone is a potassium-sparing diuretic used to treat patients with hypertension, edema, and ascites from liver cirrhosis. The drug's target is the mineralocorticoid receptors and acts as a competitive antagonist, preventing the binding of aldosterone. Discovery. Aldosterone is a hormone secreted by the adrenal cortex and regulates electrolytes and water by increasing or decreasing the renal reabsorption of sodium and potassium. Having too much aldosterone in the blood can lead to hypertension and edema as it promotes water reabsorption. This occurs due to the actions of aldosterone at the mineralocorticoid receptors in the tubules of the kidney. Binding of aldosterone at these receptors results in an increase in apical epithelial sodium channels, apical renal outer medullary potassium channels, and intracellular sodium and potassium ATPases. This allows for the increased reabsorption of sodium and potassium into the blood from the filtrate. Scientists needed to find an antagonist of the mineralocorticoid receptors to treat diseases such as hypertension and edema, and this led to the discovery of spironolactone. Early experiments involved producing molecules with both progesterone and digitoxin moieties, as earlier research had shown these as natriuretics in dogs. Seller, of G.D. Searle & Co., and his colleagues started by looking at spirolactones, as these had shown anti-aldosterone properties. They tested a series of different molecules with spirolactone skeletons and adapted the structures to try and find the most potent antagonists. This is how the molecule SC8109 was produced. These were tested on a hypertensive animal model and found to have antagonistic properties, but were only effective when given parentally. Further development involved replacing a hydrogen for a methyl group, producing the molecule SC5233, and subsequently adding a thioacetyl group, which led to the discovery of spironolactone. These changes maximised the oral bioavailability and pharmacokinetic profile of the drug, as the earlier drugs were only able to be administered parentally. It was surprising that spironolactone was the most potent when given orally, because it showed no benefit over any of the others when given parentally. Mechanism of action. The main form of secondary hypertension is primary aldosteronism, it being present in 5 to 15% of all cases of hypertension. As such, treating the aldosteronism will have an effect on blood pressure as a result of the renin-angiotensin-aldosterone system. Aldosterone is a steroid hormone that acts as a hypertensive molecule by altering the permeability of the distal tubule of the kidney to sodium, as discussed before. It binds to mineralocorticoid receptors and mediates upregulation of the epithelial sodium channels, which causes more sodium to be reabsorbed into the blood. This results in more water being reabsorbed and a higher blood volume, leading to hypertension in primary aldosteronism. The mineralocorticoid receptors mediate this mechanism through activation of SGK1, which is a serine-threonine kinase, and subsequent phosphorylation and inactivation of NED4-2. NED4-2 is a ubiquitin ligase that controls the epithelial sodium channel expression by tagging these for ubiquitination and subsequently causing their destruction by proteasomes. As such, inactivating NED4-2 will lead to less ubiquitination and an increased concentration of epithelial sodium channels. Spironolactone acts by antagonizing the mineralocorticoid receptor, as such preventing the binding of aldosterone. This will prevent the inactivation of NED4-2 and cause downregulation of the epithelial sodium channels on the distal tubule of the nephron by ubiquitination. This reduces the amount of sodium that is reabsorbed into the blood and as such reduces the blood pressure. Structure. With regards to structure, spironolactone is a cyclic ester, known as a lactone, with a substituted thioacetyl group at C7 and the gamma-lactone moiety at C17. It also has a cyclic ketone. Spironolactone is a pharmacologically active prodrug, with its active metabolites being canrenone and canrenoate. These are produced from first-pass liver metabolism by a cytochrome P450 enzyme, which removes the thioester to produce canrenone, and the lactone cyclic ester is split open and ionized to produce canrenoate, which is still biologically active. Both have a half-life of 17 to 22 hours. The structure-activity relationship. When comparing spironolactone to aldosterone, there are two main structural differences to consider. Firstly, the formation of the 5-membered lactone ring saw the increase in antagonistic activity almost quadruple. Additionally, introduction of a thioacetyl group at carbon 7 decreased the minimum effective blocking dose from 21 micrograms to 0.4 micrograms. Crystallization studies have shown that the cyclic ketone on both aldosterone and spironolactone forms hydrogen bonds with glutamine 776 and arginine 817. The carbonyl of the lactone group has very close contacts of around 0.6 angstroms with the side chain of phenylalanine 956. Electronic topological methods were used in another study to identify the pharmacophore of the molecule and the optimal distance between the two oxygens in order to have the closest hydrogen bonding interactions. They found that the 5 cyclic rings between them produced an optimal distance of 13.2 angstroms for mineralocorticoid antagonist activity. The pharmacophore identified was carbon 2, carbon 6, carbon 12, and carbon 26, as well as oxygen 1 and 3. Synthesis. The synthesis that Seller and colleagues used to produce spironolactone starts with a derivative of a molecule that is found in the testosterone biosynthetic pathway. Androstenediol is a type of steroid called an androgen, and it is used within the body as an intermediate whilst producing testosterone. Seller began his synthesis with an analogue of androstenediol, which had an ethanol group added on to position 17. Seller's synthesis of spironolactone involves 6 steps. In step 1, 17-alpha ethanol 5-androsten 3-beta 17-beta diol, which is the analogue of androstenediol, was treated with a Grignard reagent and carbon dioxide to introduce a carboxylic acid functional group to the molecule. This gave an acetylenic acid which has a carboxylic acid group at the alkyne bond. Step 2 is hydrogenation of the acetylenic acid using hydrogen and a palladium calcium carbonate catalyst, which causes the carboxylic acid and alcohol to form a cyclic ester, which is also called a lactone. This is an unsaturated lactone. In step 3, the unsaturated lactone is saturated by reduction, again using hydrogen, but this time with a palladium and carbon catalyst. This is now a saturated lactone. In step 4, the saturated lactone is treated with an oxidizing agent to oxidize the alcohol group to a ketone. In step 5, oxidation occurs again, this time using chloranil to introduce a double bond into the second ring of the structure. Finally, in step 6, another oxidizing agent is used, this time selenious acid, to introduce the thioester group. This gives spironolactone. The side effects of spironolactone are caused by its relative unspecificity to the androgen and progesterone receptors. The side effects include male breast pain and enlargement, called gynecomastia, which could be caused by the drug's ability to slow down the production of androgens and increase the metabolic clearance of testosterone. This can also cause alopecia. There have been some studies to suggest that the drug is linked to the development of breast cancer. Additionally, spironolactone increases the potassium levels in the blood, and so there is a risk of these levels becoming too high, a condition called hyperkalemia. Symptoms of this are tiredness, nausea, numbness, and chest pain. Hyperkalemia is also a contraindication, so if a patient already suffers from this condition, they should not take spironolactone. Other contraindications include Addison's disease and anuria. Spironolactone can also cause metabolic acidosis, acute kidney injury, agranulocytosis, and gastrointestinal disorders. To summarize, spironolactone is a drug that stops the actions of aldosterone by acting as a competitive antagonist at the mineralocorticoid receptors. This is an important treatment as the activity of aldosterone can cause many diseases such as edema and hypertension, which, if left untreated, can lead to further complications. I hope you enjoyed this video. Thank you.